Ever wonder why an otherwise healthy man or woman would suddenly have a devastating stroke or heart attack? They ate right, exercised, didn't smoke or drink to excess, but still, there you are, going to their funeral. There has to be something missing from the cholesterol, flabby, fat, heart paradigm that blames the victim for the disease. And there is. There's a cause. Bad bugs. The kind that make your breath smell bad in the morning. The kind that may make your dental floss pink or your toothbrush pink when you brush. The kind that infects more than 90% of the human population and are treated effectively only by a very few dentists.
And pour me a little bit.
Bad bugs that look like snakes and eat away at your gums and get into your bloodstream and wreak havoc with your arteries, immune system, not to mention the bone around your teeth. That's a missing link, and it can be corrected. Gum disease is now linked to so many problems, it boggles the imagination how widespread these problems really are. Most people don't realize that the majority of adults who will lose their teeth do so because of gum disease, caused by bad bugs. What's even more serious is that many things that traditional dentists do to try and correct this problem actually makes them worse. Like, for example, gum surgery. This painful experience is often offered to victims of gum disease as the only solution to this problem. But research, now 20 years old, shows that it actually accelerates the destruction of bone and increases the loss of teeth. And then there's the deep scaling, where the hygienist tortures the patients for hours at a time, and that the problem remains. So they come back every 2 months or every month, and they do it all again. Deep scaling spreads the disease into the bloodstream in what is called a septicemia. Bacteria are showered into the blood. Doctors who routinely look at live human blood can easily tell who has bad bugs in their mouth and who does not. Dentists or hygienists who use a microscope to look at the plaque that lives around your teeth can tell you easily if you've got the bad ones or if you do not.
Dear Dr. Kennedy, my husband was a 52-year-old family practice physician. His dentist told him he had gum disease and recommended deep cleanings. He did not prescribe an antibiotic because my husband was always very healthy and had no history of heart problems. It's been 1 year and 4 months since my husband died of bacterial endocarditis, and it feels like 1 day and 4 hours. The autopsy found that his heart had been infected by the deep cleanings. My goal is to change dental protocols so no one else has to die like this.
Now back to you. Notice how all the really bad bugs swim? They're swimmers. They aren't the ordinary gooey plaque that grows up all over your teeth like yogurt every night and stays in one place. They live underneath that layer and swim around in your gums and your bloodstream so they can infect other parts of your body. Where do they come from? Well, DNA testing has confirmed that mothers, lovers, and dogs. Yes, your pets are infected too. Basically, anywhere you swap spit. Don't let the dog lick you in the face.
What we're going to do is we're going to do a simple finger stick, and right there. And then we're going to, oh, I actually got blood. It's not green either.
No aliens?
No aliens. And from that drop of blood, we're going to pull about 100,000 cells. Now watch this, Scott, and be amazed. Well, we do actually have some pathologies. Actually, what we have...
It looks like an ant farm to me.
Now, your white count's a little elevated. And just to show you what's going on, these are white cells right here.
Two of them. That's all I see.
Actually, there's three of them. There's a fourth there. It's a little elevated, and Your platelets are aggregating a little bit. You're not processing proteins very well, by the way. Let's take a look. Here's some parasites here. Actually, there's quite a few of them.
Oh.
This is Toxoplasma gondii.
Whoa.
Do you have a cat?
No.
Dog?
2 dogs where I live.
Yeah. I've never seen a surfer yet that didn't have these. But this is Toxoplasma gondii right here, no question.
You guys are going to drive me into psychosomatic illness by the time I'm done with this thing.
Let's take a look. Now, what the parasites are doing is driving your B12 down. That's why these cells are so dark. They're spherocytes. They're actually blown up like a balloon. And so it's depleting your body of B12, which would account for your fatigue.
The fatigue factor.
See any bacteria in the bloodstream?
I haven't seen any yet.
Okay.
Nice.
Don't push it, Dave.
Ghost cells?
Oh, they're all over the place. The ghost cells, this would account for your problems with sleeping. You sleep a lot, but you wake up tired. And, yeah.
Really?
You've got a hormone imbalance too, Scott.
Thanks. This is all good to know. I think I have a fever. Just kidding.
So these are, yeah. Here's Candida, by the way. But the Candida means you've got leaky gut.
Okay.
He's got mercury fillings. He's got to have a leaky gut.
How are you feeling, Sky?
Feeling a little woozy.
I want a nice fresh drop of saliva, and I'll try not to poke you with my,
Thank you very
my
much.
tip and see if I can. Now these guys always like to live up in the back, and so I'm going to go back up in the back, nice mercury filling up here, and see if I can see if any of your friends are up there. If we don't have some of your little friends in there, then they're hiding out too much today. So this is the fuzzy stuff that we see. It's just plaque. It's the gook that can cause tooth decay. It's not the pathology. The stuff we're looking for is moving. They're jumping. They're swimming. I call them the usual suspects.
Right, there's a rod form.
Down on the bottom of the screen, there is a bug having babies because it looks like link sausages.
Yep.
You know where they get the little contraction in the middle, and pretty
Yep.
soon then you got 2 of them.
Well, I've got spirochetes here.
Spirochetes are really bad actors and look like snakes. They eat blood, and they can bite through mucosa, and they're smart too. They can even bite a white blood cell, like right here. They wriggle in unison to make a pump, like a heartbeat. And they'll take a rod, bite on its side, and then move together to create a circulation around the gum of saliva so that more germs can fit into a smaller area and eat you. These aren't your friends. And what's nice about them is that they're pretty easy to kill.
Scott, thank you very much for coming by today. It was great seeing your blood on the screen and seeing your saliva and seeing what kind of things we can find inside you. We'll see what happens next time.
Here's what the good bugs look like. Notice that there's no movement. They're just sitting there, not eating you. Now here is an infection with spirochetes, or I like to call them snakes, rods, and some very bad bugs. It's not good to have smart bugs swimming around in your gums and your bloodstream. You are infected, and there is a solution, one that you and your dentist together can do. It's called kill 'em. Just kill 'em. And a warning. Fluoride makes this disease worse. So don't grab your favorite fluoridated toothpaste and start doing the new things you're going to learn about today. Fluoride kills bones and causes inflammation. There is one really bad actor that will take a special program on your behalf from your hygienist or dentist, and it's called one-celled animals, amoebas and trichomonads, that are frequently found in severe cases of gum disease. These are parasites. This animal lives in the gums, but it also lives in the jawbone, or the liver, or the intestine. It's throughout the body. So if you just kill it in the gums, it comes back. You never really got rid of it. You've got to kill it everywhere. And there is a way, but you can't swallow a pill to kill an amoeba in the gums. You've got to put the antibiotic in the gums and the body at the same time, and that takes a knowledgeable professional. Consult your local preventive dentist. They will have a microscope. so they can take a sample and you both can see if you have the bad bugs. Get the dentist or hygienist to wipe them out, kill them, and then teach you how to keep them gone by irrigating at home. Periodically have your dentist or hygienist check and make sure they're dead. They are, after all, contagious. And it's as simple as that. Kill them and keep looking to make sure they don't come back. Now that you know the enemy, I'll tell you how to kill them. Stir them up and change the water they live in. The juice that is around every tooth can be washed away and changed to saliva that kills bacteria and doesn't kill you.
One particularly useful instrument that you can use at home to help prevent these bugs from multiplying in your mouth is called the Viajet irrigator. This is an electric appliance that pushes out a pulsing stream of water that can remove the bacteria from the surface of the teeth and help irrigate the spaces below the teeth with either water or with an antimicrobial agent, so that you can get at bacteria that are simply impossible to get at with an ordinary toothbrush.
An irrigator is probably the best thing to get down to the bottom of the pocket, and we can add products to the water in the irrigator to carry that product down. Toothbrushing and flossing will not do it.
Now, before we begin, I want to warn you that while doing the things I recommend will prevent disease if you've already become infected, you should start by disinfecting the whole mouth first so that you don't spread the germs into the bloodstream. Remember I said deep cleanings will spread the germs? That's true, but only if you don't kill them first. If you do, then you can almost completely prevent the bacteria from getting into the bloodstream. That's what I recommend. Kill the bugs before they can get in the bloodstream and kill you. After the hygienist's second visit to completely disinfect Scott's mouth, Dr. Smith again sampled his blood. Only this time...
This is so pretty. The plasma, look how clean it is. Those are really
Clean.
that center picture.
Uh-huh.
That's as good as it gets, man.
And I'm right in there.
You're right in there.
Bless your heart, Scott.
About 1,000% better than last week.
Man, look at this.
When we sampled the bacteria from around Scott's teeth, the amoeba, the spirochete, and the rods having babies are all gone. Disinfection is really simple. Irrigate with a disinfecting agent, and then look. One thing many people have difficulty in understanding is exactly what's the difference between the old approach to treating gum disease and the biocompatible approach. When you look at the procedures, they look the same. The tools are the same, but the goals and the results are entirely different. In the past, gum disease was treated surgically and mechanically. The object of the therapy was called pocket elimination, where tissue was excised and roots were exposed. Bone was recontoured and ground down, and cadaver bone was implanted. A mechanical surgical approach to an oral infection. Biocompatible perio takes a modern CSI approach to an oral infection, where the cause is identified using the tools of modern science and then eliminated with repeated applications of disinfecting agents both at home and in the dental office. Many hygienists and dentists are taught to deep clean teeth 1/4 of the mouth at a time using only mechanical tools, either scalers or ultrasonic cleaners. Although this approach does slow the disease, this makes no sense at all. It is just as silly as trying to wash one hand at a time or one finger at a time. With the biocompatible approach, the whole mouth is disinfected at each appointment. Some will say this is an impossible task, like disinfecting skin, but that remark only comes from those who haven't practiced this way. These bacteria are parasites and abnormal bacteria, and they aren't your normal flora. They're pathogens and have a totally different lifestyle. Once you've killed them, unless you get reinfected, you're no longer infected. So the big difference in approach between the old approach and the biocompatible approach is the goal. The goal is to eliminate the bacteria rather than eliminating tissue. This yields a tremendously healthful result.
The main reason for dental infections is that they are opportunistic and that the body's defenses have gone down too much because of diet, and the bug or bugs are there because the body isn't able to do its job correctly to remove them, to kill them, to eliminate them, and that's also due to diet. And what's going on is that we're giving them their favorite foods. We're eating lots of starches, we're eating lots of sugars, and so everything that the bugs want is sitting there as a food in the body, and they're very, very happy. One of the most important things we have to understand is that Dr. Weston A. Price, when he traveled around the world searching out and living with and studying traditional populations that were eating all of the traditional diets, is that all of the various different dental problems that we have today, whether they be tooth decay or root canals or extractions being caused by the structure of the mouth being too small to accommodate the teeth, have been shown by him to all be caused by incorrect food. And therefore, that's the real prevention we need, is to go back to traditional eating to prevent all of our dental problems.
A pediatrician in Puerto Rico published a study of infants who were engaged in risky behavior. She saw child after child with teeth rotted off at the gum line, and the reason was very simple. The mothers were putting them to bed with milk or sugared milk, which is a common practice. That'll rot the baby's teeth right out of their head. So she tried various levels of fluoride. That didn't help. But she also used povidone iodine. 6 times a year, they dabbed the baby's teeth with a Q-tip. None of the fluoride preparations had any beneficial effect, but the iodine reduced the expected tooth decay more than 50%. Just think what could happen if they'd done it once a day. Why did iodine work so well? For one thing, it's a nutrient, and humans need it. And for another, the preparation was the kind that kills germs on contact. Tooth decay and gum disease are caused by germs. You kill the germs, you stop the problem. It's really that simple. I found lots of things work in an oral irrigator. Even just plain water helps. But if you put something in the water that bacteria don't like, that works much better and faster too. Iodine is fast and thorough. You don't have to blast them off like a car wash. They're swimmers. So if you change the saliva they're swimming in to iodine-treated saliva, they'll quickly die, and that's what you want. Lots of things kill bacteria. Salt water, for example, will do just fine. The easy way to use it is to have it already made up, so you can easily pour some into the irrigator and squirt away. Here's my simple recipe for oral health. First, you take 1 large mason jar. Glass is best, but plastic will do. Then add 1 inch of salt and 1 inch of baking soda. Now pour in enough hot water to fill up the jar and then mix it. Now set it under the sink and let all that unused salt and soda sink to the bottom before you use it. Grit in your irrigating solution will plug your water irrigator, so let the grit settle out. Next, you can begin your normal oral hygiene procedures such as flossing, toothbrushing with the bass brush, toothpicking, to stir up the gooey bacteria that grows on the teeth and clogs up the gums. Once the grit has settled to the bottom, you've made what's called a saturated salt solution, but it's really too strong. So now you can dilute it 50-50 with warm water, and the temperature will be just perfect. You can add a splash of iodine if you like, but now you're ready to irrigate. Check the power setting to make sure it's on low, and you're going to use the big tip, which you can point in between your teeth one at a time all around your mouth, first outside and then inside. The reason you're using the low setting is that you're not doing a car wash. You do not need to blast these bacteria off your teeth, and just as we showed you in the earlier part, you can blast them into your bloodstream too. You don't want to do that. You just want to rinse them away gently with a good firm stream of water. Once you've finished with the irrigator, you need to rinse out the irrigator or it won't run next time. Salt will plug it up. So, all you got to do is run some fresh water through the irrigator before you put it away.
But doctor, what if I have bigger problems, like deep pockets.
Then you probably need some special training and some special help from your dentist. Deep pockets tape deeper tools. Once they are well, they probably will heal up to the point where this extra attachment is not necessary. But for now, I assume you've got some serious deep holes where the bad bugs have eaten away a lot of bone. In most cases, there is an amoeba involved in this type of disease, so I sincerely hope you've had that treated, because they are not your friends. And they don't go away because you want them to. They're parasites. They're living in your gums. That's what's causing these deep, deep pockets. Your dentist or hygienist can train you to use a cannula in deep pocket areas. A cannula is a tiny tube with holes on the side. It can be attached to your irrigator. And when the irrigator runs, it sprays out like a rainbird yard sprinkler in all directions. The sprinkler needs to be gently inserted into every pocket and sprinkle the pocket with a strong solution of bug killer. Like I said, iodine is one of my favorites, but lots of things work. Even herbals. What you use is up to you and your dentist, and if they have a microscope, you can confirm that it actually did kill the enemy. Unfortunately, those amoebas are hard to get out because they don't just live in the gums. They live throughout the body, so you will need special help to get rid of those. The key is that when you look under the microscope, the bad bugs are gone. If not, use a disinfectant and antiseptic that kills the bad ones. It's as simple as that. Iodine kills everything, but it can stain the floor and the ceiling, your clothes, orange if you're not careful. Chlorine, diluted bleach or chloramine tea, kills on contact also. Herbal oils, such as oil of oregano, are somewhat effective, but don't take anybody's word for what works and what doesn't. Do it and then look. That's the only way to be sure. Another product that is particularly effective that can be used with oils is ozone. Ozone is O3, and it can be bubbled through stuff like oil of oregano or even olive oil, and then inserted into the pocket where it becomes a very effective bug killer, and it kills viruses as well. And so Scott, as the principal volunteer and guinea pig in this wonderful documentary, you've been through quite a lot in the last month, and I'd like you to share with the listeners something about your experience of getting your mercury fillings out and killing off your bad bugs.
It feels really good to be free of these bugs, which I saw on the screen at the blood testing doctor on his little computer screen. And I felt better since, and certainly to have all the mercury that was in there for 50 years gone is pretty encouraging. So I'll continue to have mercury, metal-free mouth and see how it goes.
And if you were going to give some warnings to anybody else considering having a major oral revision, if you want to, what kind of suggestions can you offer?
Well, when you look on the screen and you see all the 3 or 4 different kind of bugs which contribute to major diseases, it's very relaxing to know that that is no longer in your mouth, going through your blood to your heart and other areas where it could infect you with these other diseases. So it feels really good. I recommend others at least have your blood tested. For I think $100 I had my blood tested and found out everything I had, and then it confirmed after the fact that I was free of all those.
And you referred to the critters that you were looking at as the ant farm. When you were a child, did you have an ant farm?
Actually did have an ant farm. We sent away in the mail for it, and I think they lasted 3 weeks. I don't know what we were feeding them, but it was fun while it lasted.
Now you have had your own ant farm for quite some time, but they came from somewhere else. Let's see. At home now, what does a weekly routine look like at your place?
Well, we moved into fine oral hygiene practices now. We use a water pick. We used a toothbrush with softer bristles instead of the iron bristles I was using in the past. You assuring me that the softer bristles get in between the teeth. So the main difference, of course, is the water pick, which keeps the particles out from under the gums.
And do you put anything in the water pick, or you just use tap water?
I'm using vodka, bourbon, and tequila, which that way you can swallow it and not have to have a problem. Let's re-ask that question, shall we?
In using your water pick, do you put anything in it besides the vodka and tequila?
I've been using baking soda and warm water. It's been my mixture.
Has your relationship changed at all with the dogs that you live with?
Well, the dogs, we're aware the dogs carry some of these bugs, so as they lick your face, that doesn't happen anymore. So I'm much more aware of that.
Is there any other advice that you'd give to people who are looking for a better way to have a healthy mouth?
Well, outside of being pet-free, mercury-free is the key thing. I had my cavities, my amalgam of various metals, including mercury, for 50 years, and I'm just really happy I'm not having that now, because I know that it can fume when you brush your teeth, and it can get in your bloodstream and poison you, and also form sort of a nice living condition for all the bugs I had in my mouth.
And so there you have it. Many of the diseases of mankind are caused by microorganisms and animals that live in our bodies, live in our gums, and spread from there throughout our bodies. The solution is really simple. Kill them. You can disinfect them. It's called hygiene. There's nothing controversial about it. It's simply the practice of good oral health care. And the good news is that it's available to everyone for a very modest cost. All you have to have is knowledge, and that's why we've made this video, to bring that information to you so that you can take charge of your oral health. And what you'll find is you also get a lot better handle on your overall health. You can find more information about the things that the International Academy of Oral Medicine and Toxicology recommends by going on our website, which is on the screen, www.iaomt.org, and on my YouTube channel. It's David Kennedy DDS, and you can search on my name or on the title Bad Bugs, and you'll find us on YouTube and many other places. So we're doing our very best to get the information out to you so you can take control of your health.